What up, guys? It's Matt, and I just wanted to go ahead and start recording for my year in review for respiratory therapy. So I completed my first year officially on Tuesday the 16th of May, and I get a little time off here to kind of reflect back on the first year. So in the first year, we've had a lot. It was about a year ago that I started making these videos for YouTube. I guess a little over a year ago. You know, I guess I didn't know what to expect coming into the program. I mean, I had an idea of what respiratory therapists did. I knew some of the the broad spectrum that they can work in or cover, but I really didn't know the finer points. I went in completely with a blank book and an open mind. I had some comments, I think, in the last few videos. Some people getting ready to start their first year or first semester and excited and nervous, and there's no better way to describe how I felt when I was starting. You know, my wife had went through nursing school. I kind of had an idea how much time I would absolutely have to be putting in to make this work, with the added challenge of having kids. As a matter of fact, having one kid already and my wife being pregnant with our second when I started the program, knowing that she would be due mid-program. So it definitely added a level of challenge above and beyond, I think, what most students kind of experience as normal jitters at the beginning of a program. So I just wanted to start by basically talking about the classes I covered. So my program, these are the classes we covered my first year. We did basic therapeutics, cardiopulmonary A&P, an intro to respiratory care class, and that was it. The basic therapeutics had a lab associated, and that's where we started learning. That's when I got my hands on my very first small volume nebulizer. So that's what we were doing. We were assembling some of the most commonly used equipment, learning how to use it, stuff like that. And of course the lecture, sometimes really in depth about how the stuff worked, the various physical principles of the different pieces, and just really where the lab, you were kind of getting this snapshot. So lecture, we would cover a whole lot of stuff, and then we'd get into lab and maybe not see every single tiny piece of equipment that you may come across, but kind of the most common stuff, but getting hands-on and assembling stuff. And that was a semester that I had our clinical simulation, where we had to go in and assess a patient, and there was another student who played a family member, so you kind of got that first real experience before heading into clinic. And the other classes, cardiopulmonary A&P, of course, just reinforced A&P that you've already learned, with specifics to respiratory care. What are you doing with all that information? And then the intro class, I think, was it covered a required. They basically covered a requirement from the school, and I guess co-arc for having to meet some minimum. You had to write a paper. That was the class that I complained about having to write the paper. So that was that. It was an easy class. You got basically learn about the history of the field. Was very interesting. I'll say that. Learning about where it started, not so much way back, like hundreds of years ago, but this being a relatively new field, like being less than 70 or 80 years old. It was really cool to learn about that and where it came from, and just kind of reinforce that. You think about that, like prior to World War II, like the field didn't really even exist, and now here we are. So I finished that semester, culminating into this last semester, where I had basic assessment. I had our intro to mechanical ventilation, my pharmacology, and my disease and disorders class. So we added an extra class. We still had a lab associated with the basic assessment, and we also added clinicals. So definitely a stepped up level of intensity this semester. I've said it multiple times in prior videos, the second semester was rumored to be the toughest of all the semesters, even compared to the whole entire second year, because it's your first time getting into clinic, and it's adding an extra class, and then the difficulty of the classes, so pharmacology and mechanical ventilation, basic assessment, like just a lot more expected of you, because you're really laying all that groundwork for the stuff you're going to be doing. So again, it wasn't easy. We definitely busted our tails. I would say that the lab portion of basic assessment wasn't as involved. It was a lot of just reinforcing the learning, not as much hands-on stuff like basic therapeutics was. You know, there's nothing really, I guess, to assess on each other. It's hard when people don't actually have some sort of a disease process going on. So ultimately, it was a grind. I mean, starting that semester, I had my daughter, so she was born November 1st of 2016. So I went full in this with 2 kids. For the first part, it was a little easier. My wife was still on maternity leave, but when she went back to work, you know, it was finding childcare, and it definitely added a lot of difficulties to this semester, beyond the difficulties that already existed this semester. But I managed to make it, and I not only made it, but I made it with all A's. The school is challenging, respiratory is challenging, but look at me, I guess, as an example of if I can do it, anyone can do it. I don't have a historical track record of doing super awesome in school, dating back to like high school. I graduated pretty low in my high school class in terms of like that class ranking, and I spent most of my late teens and early 20s kind of floundering around in college. But if you're truly passionate, or you truly have a genuine interest in this, it's possible. You make it work. You know, you sacrifice some sleep, you sacrifice some social time, you make it work. My wife told me that I made having a job, going to school, and maintaining a family look easy. And it's a huge compliment from her, because she worked her butt off in nursing school. It's not easy. Yes, I might make it look easy in her words, but it's not easy. You definitely have to be willing to sacrifice some things, and then just put in the extra effort to succeed, to do well. So so let's talk about clinicals then. So yeah, this last semester too was my first you know, dipping our toes in the water, so to speak. I was placed at the large university hospital in my city. At first I was a little upset about that. It just wasn't one of the hospitals I wanted. It turned out to be a really, really awesome experience, and on a little side note to that is make the best of every experience you can. So even if you didn't get the schedule you liked, or the hospital you liked, or the shift you like, make the best of it, because you're there. You could sour your experience, and you could sour everyone else's experience by bitching and complaining about it the entire time, kind of like I was doing early on. Or you make the best of it, and you never know, you come to find out what you thought you would like, or what you thought you didn't like, could be completely different. You can't judge a book by its cover. So I had a really, really awesome instructor, and he made very well sure that we got the most out of our experience every time we were there, to the best of his ability. Now, there were days where we were competing for clinician time with sometimes 2 or 3 other schools who happen to be all at the facility at the same time. And due to my odd time coming in to the rotation being a 12 to 4 short shift, you know, sometimes there were no therapists even to go float with because they already all had 1 or even 2 students. And it was those days where, you know, he would take us down to the department and quiz us or instruct us like, hey, so do you remember how to do total flow? He'd reinforce things from lecture sometimes that he felt like he'd seen a lot of students come out weak in. He'd pull out a BiPAP or a vent and turn it on and be like, hook up these circuits, let's set some initial settings, and sometimes give us scenarios about like, what would you change here, or on this mode you change this to alter this function. So he always made sure to have something ready for us. There was never a day where it was just like, sorry guys, just head home. He always made sure, if it meant him taking us down to the ED, maybe bugging a therapist who didn't want to take a student, like, hey, do you have anything we could do for you then? Like, you know, take us through the ICUs, even if we weren't cleared to do something in terms of like critical care. He would at least volunteer his ability to a therapist, be like, hey, my students would like to observe, do you have anything for us? It could be something like a trach suction, sputum sample collection, anything like that. I mean, there were 4 of us students one day. We were in an ICU room and we got to do a trach care. You know, he gave us a rundown and we all had our sterile stuff on, and he showed us how to do it, and we all took turns basically cleaning crud out of a guy's trach, putting the new collar on and stuff. So he always made sure that we had a good experience, and ultimately it made for an excellent experience this semester. You know, we had plenty of small volume nebulizers going on. Anyone who's been through clinic, you know, you're going to do a few billion of those in your career. I got to go to my first code. So even though I didn't get to do any ABGs, I went to a code. I saw more than one code go on, but the one I got to participate in, you know, it was an experience, and unfortunately that patient didn't make it. But you know, it was my first experience with critical care. Kind of my first experience with ACLS. Now, I'm not certified and I wasn't expected to run a code or anything like that, but being CPR and BLS certified, to see compressions, to be able to bag, and you really realize how dynamic that experience is. A code really is. You get in there and, you know, you're always taught to bag once every 5 to 6 seconds during a code, because if they're have an advanced airway. But in this case, you know, like if the doctor says you need to bag faster, you need to do something different, you're doing something different. It's really cool to kind of see all that stuff go on. And then the experience of death and having a patient's family come in and, you know, learning how you handle that. It was a very unique and humbling experience for me, having to go back in on the doctor's orders to turn off the vent. You know, the son was happy with the work we had done, and it was ready to let his mom go in and turn off a ventilator. That's huge. You know, that's something that you'll likely experience at some point in your career. So you know, you definitely need to check yourself, stay professional, and all that kind of stuff, because it was, for me, it was a pretty new experience. So that's really it for the school experience. Now, some of the other things that I was able to participate in over the course of the last year. We did the Lung Force Walk, the American Lung Association's Lung Force Walk. Did a big event down on the university campus, and so we went out and we represented our school and had all of our donations, and we all walked. in support of lung disease research. And so that was a pretty cool experience. You get to see, we got to learn about volunteer opportunities that there are. So that was really cool. We participated in something called Zoo Light, so it's at our zoo here in town. And one of the nights where they actually, it's like a big honor, like awards thing for our school, and the respiratory department volunteers that night. We hand out the maps, and we can help people find places or stuff like that. We hand out like little glow sticks and glow rings for kids. And it's around Christmas time, and so they do lights all over the big zoo here. And it's really cool to see. I've actually gone in the past, and so it was my first time, obviously, volunteering to help, so it was really neat. My school held their first ever in-house student conference, so something just for the first and second years, where they brought in various speakers. They brought in our medical director to give a little presentation on sleep studies. They brought in representatives from an LTAC to kind of talk about exactly what goes on at an LTAC, because you can read a lot of negative things about LTACs, and then to see specifically what a respiratory therapist would do at one, that was pretty cool. So and they brought in a few other people just to give presentations on the various topics, the different hospitals. They brought in a director from one of the local hospitals to speak to us about not so specifically resumes and interview tips, but just things that directors generally look for. You know, how important is that 4.0 versus how important is it that you made the most of your time at his facility, and that his therapist took note that, like, hey, this guy was really good, or hey, that guy was a schmuck. So and then the last thing, of course, was my big the Arizona Students Respiratory Conference. So the Society for Respiratory Care in Arizona held a big student conference. It was like the 7th annual, I believe. That was where all 5 respiratory programs in the state were together, and that was really neat. You got to network a little bit. You got to meet influential people in respiratory from all over the state with all varying levels of experience. Some of it was kind of rudimentary, and some of it was useful. All in all, it was a really good experience. It was fun to go up and get out of Tucson for a day and just really get that experience. And of course, this summer, the AARC Summer Forum is actually in town for us. So we're gonna go at least one day. I might try to go the Sunday that it starts too, and get to experience that conference feel on kind of a grand scale. You know, see all kinds of vendors and things like that. I think it would be really cool to go do. So the last things we have coming up is my summer clinical. So that starts the day after Memorial Day. So what is that? May 30th. 6:30 a.m. sharp. I'm going to be going in and doing my first ever 12-hour rotation. Don't know what to expect. The facility I'm going to, they get some sick people, but it's a smaller facility. It services a smaller portion of town. I imagine we'll have quite a few breathing treatments. Some of the other students who were there at that facility this last semester said you will definitely become proficient at least setting up EKGs for recording. Not necessarily interpreting them, although that might be something I try to work on a little bit this summer. So all in all, I'm super excited about that. They still have a little ICU there. They have a little ED there. I'm sure we will get some experiences, and I imagine we will get opportunity for ABGs, especially working full 12-hour shifts. So the last thing I'm going to end on is, I guess I'll just talk about real quick requirements of your program. So the gal who like takes care of all that stuff for us, who like gets the reminders out and sets up all the onboarding for all the clinical sites, reached out because there was a bunch of people whose stuff was coming near expiring. Specifically, she said TB and CPR requirements. So you remember, guys, don't wait till the last second, like somebody, to get that stuff taken care of. If you know it's coming up for renewal, like just take care of it. My TB was expiring during the middle of this last semester, and that actually caused a problem with my onboarding back in January with the hospital I was at. It kept flagging it as bad, and it took me forever to figure it out, and there was no real easy way to communicate with the hospital's onboarding admin about why is it flagging this. And finally got a hold of them, and they said it's just because it's expiring, so make sure I took care of it before it expired. So I took care of that. And then I actually have my CPR coming up due. I'd gotten a 60-day notice from our secured profile, so I knew I had to like look into it. And yeah, sure enough, I think mine expires on the 31st of this month. So I'm actually going in Friday the 20th to take care of my new CPR certification. So don't slack on that stuff. Just take care of it. So yeah, guys, that's kind of my recap for the first year of everything that I did. Again, I just want to stress that all you newcomers coming in, like, you know, it's okay to be nervous. Definitely be excited. You're gonna have a blast. You're gonna work your butt off. But it's a really memorable experience. I made a lot of good memories, I would say, especially with clinical experience. Like, it just memorable patients and memorable experiences for sure. But I'm definitely looking forward to this summer and the next semester, and eventually really becoming proficient in the field, perfecting my art, and then hopefully becoming a therapist here. That's the end goal for us all. So anyways, guys, thanks so much for watching. Thank you for all of the likes and subscribes and the support really over the last year. We made it. And we're getting ready to start the second part of this journey. So everybody, thanks for watching, and I will talk to you guys soon.